you do. Or, no, you can tell because I don't know what you do.
Okay, well, I'm a neurosurgeon. My name is Jerry Petty, and I've been here in Charlotte 43 years. We do a lot of, we do mainly brain and spinal cord surgery here. We do a lot of trauma, as you can imagine. That's the main thing we do.
Okay. You recording? Oh, okay. So on my graduation project, I'm doing stem cell research. Do you know a lot about it?
I know a little bit about stem cells. I know that so far, in terms of in the brain, most of it's been, they have done some work on fetal stem cells, I think, in the brain, putting in the brain of mice and animals. I don't know that any of it's been used therapeutically yet in a patient, in a person. In the spinal cord, I think the stem cells, they're capable of making of getting them to grow the kind of cells that are needed in the spinal cord, but I think the problem there is going to be to get the tracks to line up properly. Like if you had something that was sending a motor discharge or something to make a muscle move, and it was connected with something that was normally bringing sensation back, it would not be it wouldn't work. I mean, and so the problem is in the brain and spinal cord do not regenerate cells. They heal with scar tissue when they heal. And if you could get stem cells to come in and take over the cells that were damaged, or be those cells, or act like those cells, then it would be very useful. To this point, that hadn't been done.
I really didn't know that brain cells and spinal cells heal with scar tissue. I didn't know that. Okay, so you know about the controversy in the states about legalizing stem cell research? Are you for it or against it?
Well, I think as long as it's well controlled, I think it would be very helpful. I think that maybe some of the fear is that it would get out of hand and people would start using it for things that it shouldn't be used for, or trying to use it for things it shouldn't be used for. So I think there's no question that there's a lot of good that could come out of it. And I don't know the bad things that could come out of it, but I'm sure there are things that could be done that would not be very good.
So do you know the difference between stem cell or the embryo stem cell, or embryonic stem cell, and adult stem cell?
Yeah, the embryonic stem cells, I think, are those that will they're more pluripotential, or they can make they can make any kind of cell theoretically. Sometimes it can be guided to do that, or they can do things to the culture medium to make it turn a certain way or do a certain way. And adult stems, and they can keep reproducing themselves. Adult stem cells tend to mature and differentiate before they want them to, I think, sometimes. So the embryonic stem cells are more useful for most things, and would certainly be able to be used in a lot of different contexts.
Okay. Do you believe that stem cell research is the same as cloning?
Cloning, in a way, it would be, but cloning is I think your goals are different. I think if you mean cloning, making another stem cell, then I think that's one thing. But if cloning is making Dolly the sheep, I think that's a totally, the process would be maybe very similar, but the outcome would be, and maybe this is one of the things they worry about with what were some of the things that could be cloned.
Yeah, a lot of people think that, like, if you take cells from somebody else, I don't know how, I guess they'll, like, turn it to them. But I don't know where that came from, but that's another one of the problems in the legalization of it, too.
Right.
So, yeah.
I think that I think the potential for what could be done is amazing, like livers and spleens and things that could be hooked up. I mean, if you have a heart, then you can, I mean, it's not easy to do, but that can be placed in somebody and work. Whereas a spinal cord and brain, there's more connections in the brain than there are particles in the world, apparently. There's trillions of connections in the brain and to try to go in and put something in there, put a cell in there, especially a nerve cell or an axon or a dendrite that has to, it's not just a supportive cell, but has to make a connection or a synapse with another cell. It's going to be harder to do, I think.
So, like, for my mom's injury, would you think the stem cell research will help her?
It could. I think hers is more of a peripheral nerve injury, and peripheral nerves can regenerate.
Peripheral nerves?
Peripheral nerves. A nerve, like a nerve in your arm, a nerve in your leg. They can, there can be regeneration in that. And it's easier to see how that, but here again, if it's a mixed nerve, it's a nerve that has both sensation and motor function. In other words, a nerve that allows you to move your hand, and a nerve that allows you to appreciate if somebody puts something in your hand, what it is. There's some way you're going to have to, something's going to have to cause it to be a motor nerve or a sensory nerve, and it's going to have to connect with a motor nerve or a sensory nerve to be effective.
Yeah, that does make sense. So, okay, well, that's all I need to know.